Okay, so we are looking at the psychosocial support / adherence counseling. And this holds links to 4 functionalities. A link to schedule counseling appointments, to view the pending appointments, to start a new encounter, and to review the past encounter. In the previous session, we have seen 2 types of adherence counseling session. We have looked at the adherence readiness assessment and the adherence strategy work plan. Today, we are going to look at adherence follow-up assessments, and then we will review all of the functionalities as a whole. So for today, we are going to use the case scenario, and I put it in the chat for you to follow. For a counseling appointment, we have 3 types of appointments. When you put in a client's unique ID, so I'm going to use one of these IDs from the scenario. So I'll use the last one, G1234. When you put in a client's ID, you click on the button that holds the purpose of the appointment. If you are doing an adherence readiness assessment, and this is for clients who are to be placed on ART and are not yet on ART. Adherence strategy work plan are clients who are not ready to be placed on ART, but you want to get them ready as soon as possible. Adherence follow-up assessments are for clients who are on ART. So when a returning client comes for a subsequent clinical management visit, you give an appointment for adherence follow-up assessment. Once you get a success message, you can now go to psychosocial support or adherence counseling, and you click on Start Counseling Encounter. Before you start an encounter, you might want to review the client's file, past psychosocial support file, to see if there's any information you want to know about before you start the session. And for that, you go to Past Counseling Encounter. You enter the client's unique ID and last encounter. This now gives you information about the pretreatment adherence counseling, which was done before the client was placed on ART, the adherence follow-up assessment, which has never been done, and this is what we are going to do today, and the adherence strategy work plan, which was not needed for the client because the client was ready on the assessment of the pretreatment counseling session. The reason you want to look at this is because this only displays the most recent recordings. So you will not have any way to retrieve the past recordings from this page. Once you save a new recording, then this is replaced with the new one you have. So this displays only the most recent. So you want to start this session after you have informed yourself about the past or the last session that the client had. You come to Start Counseling Encounter, enter the client's unique ID. The type of counseling session you selected when you schedule the appointment is going to generate the form for the encounter based on the type. So for each of the 3 types, there are 3 different forms. So this is the form for medication adherence assessment. And what this form does is ask questions about adherence in the last 3 days. So you're going to ask the client, I have questions about the medications you, and in the case of a child, your child, took over the last 3 days. We are trying to understand medication adherence habits, so please share with us your routine in taking your meds. And so you want to see the names of ARV med missed. Now, what this does is it's the drop-down menu selects from the prescription that the doctor wrote last for these clients during the clinical management visit. And so if the client is not on ART, you will not find anything on this drop-down menu, which means that this client was not prescribed any medication or the doctor did not record it on the system. So because this client has something here, that means the client has this ad or is on this ARV. So you want to ask the caregiver now, because this is a child. So you ask the caregiver, so yesterday, did you miss any dose? She says no, I will say none. 2 days ago, she said yes, she missed 1 dose. 3 days ago, she said yes, she missed 1 dose. The client is not on any TB meds, so this is the only medication. So you skip this and you skip the missed doses. So you ask, how closely did you follow your schedule over the last 3 days? You don't necessarily need to ask this question once you collect the information about the doses missed yesterday, 2 days ago, and 3 days ago. So now you can put sometimes here because the client did not miss yesterday, but 2 days before missed the doses. What did you do to help you remember, take or give medication to the adherent? So let's say treatment assistant. So the mom is a treatment assistant for the child. There are other options like other pill boxes, alarm or text messaging, any method the client uses to remember to take medication. Did you or your child skip or miss any of your medication? And you say yes. And you want to ask under what circumstance. So let's say she traveled for 2 days and she did not disclose the child's HIV status to anybody else. And so she says when traveling. And when she returned, she got back adherent. So reason for missed or delayed medication for adults is not applicable because we're talking about the child. So reasons for missed or delayed medication for child, we'll say caregiver. So let's say caregiver moved. So the caregiver traveled. What issues need to be addressed to improve the adherence? So there are 3 types of issues that need to be addressed, either the patient's or caregiver related issues, the health team related issues, or the environment related issues. Under patient or caregiver related issues, we want to address issues of being away from home. Under the health team related issues, if maybe you have a situation where the client is not adherent and the client blames the healthcare system for not being adherent, possibly because of drug supply. At this point, you select drug supply. Maybe they missed 1 week because it was stock out. But in this situation, there was no health team related issue, so none. So environment related issue, she had a stigma issue and she did not disclose the status of the child to anybody else. So when she's not around, nobody else helps the child. So we'll say address stigma. If adherents continue current treatment as it's were, so in your own opinion as the adherence counselor, do you think that these people are adherent or they are not? But we want to say, okay, they took their medications all the time, apart from the time where the caregiver traveled, which she had a genuine reason for not giving it out, and she did not make arrangements for how the child would take the medications. So we say you can continue the treatment because this person is adherent. So if not adherent, have adherence team reevaluate client situation. So this is not applicable. So just reminder to help client or child take medication. So you want to counsel on what she can do when she travels and the child needs to take a particular medication at a particular time. So because now you can't think of anything and the mom doesn't want to disclose, just wants the status to be known only by her. So you might want to say you want to have a treatment partner when she's traveling. She wants to tell a nurse or somebody around that is a healthcare provider who can check on the child without disclosing the status, or she doesn't want anything. So we'll say not applicable. If you have any comments based on this client, you can now type it here. So client was counseled to disclose child status to a secondary caregiver. So you can type anything, any length, and then you click on save. Once this is saved, you get your success message, and then you are done with this session, and it redirects you to see other appointments that you have for the day. Now, the thing with the appointment is the date scheduled is a date you will see. You can do the appointment at any point. So you can schedule an appointment at the end of clinic today for the next clinic session, but you don't give a date to appointment for counseling. Anytime they come, you can start the encounter any day, anytime. So once you are done with this, you can come to past counseling encounter, put in the unique ID, and click on last encounter. And now you can view that you have the last encounter on the page for you to review during the next visit, or for anybody to review to see the client's adherence. So this is all about the medication adherence and follow-up assessment. So for every clinical management visit, you want to do this assessment before the client sees the doctor for another prescription or for evaluation of side effects or anything. So this is going to inform the doctor based on the reports the system will send to on the care card of the client, which you will see on Friday when we look at clinical management part 3. You will see what the system generates as the reports based on what is filled here. And the doctor can make a decision whether to change medication if the reason for non-adherence is side effects, or whether to stop giving medications if the client is not adherent and has decided or has said that they will never take it, or for any other reason. So the doctor can use their judgments to decide what to do next. I'm going to review all of the psychosocial support and adherence counseling and how we get there. When a client comes into the system, into the clinical management system through the referrals, the client is registered into care. When the client is registered into care, then the psychosocial support and adherence counseling is now activated for you to be able to schedule appointments for that client. The first-time client that visits will need to have an appointment for adherence readiness assessment. Let's assume that G1234, the same client, is coming for the first time. We are going to give appointments for adherence readiness assessment. You want to do this readiness assessment before the client sees the doctor, and you want to know if the client is ready to be adherent to the ART that will be prescribed, or the ARV that will be prescribed. Once you schedule the appointment, you will go to Start Counseling Encounter, enter the unique ID, and get form. Now, this is the same client we use to demonstrate the medication adherence assessment. We are using the same client, 11 years old, and we are seeing that the form generated is now different based on the type of counseling session that we schedule the client for. Now we want to see if this client is ready to be assessed. So we are going to ignore the fact that the client is on medication and we have done medication adherence assessments. We are assuming or pretending now that this client is coming in for the first time and was just registered into care. So the adherence readiness assessment form asks questions that look at the mental state of the client or the caregiver, and also to assess if the client is ready to adhere to the medication. The first question is, how many sessions of pretreatment counseling did the client attend? Let's assume that this is the second session. Is the client's treatment literacy sufficient? We'll say no. Does the client have misconceptions about ARV? We'll say yes. And she feels that the medications are too expensive. And then you counsel her on she's not going to be paying for them and it's going to be free. Has the client disclosed his or her status? We'll say no. So now we're asking if the status of this child is disclosed, and it's the mother, the caregiver we're asking. And apart from the mom, the status of the child was not disclosed to anybody else. Is this person supportive? And this is not applicable. Has the partner been tested for HIV? It's not applicable. And is the partner taking ART if living with HIV? Not applicable. Does the client have children? Not applicable. Does the client have a treatment assistant? We'll say no. Did the treatment assistant take part in the pretreatment adherence sessions? Not applicable. Does the client wish to be visited at home? If yes, describe the location in details and the contact person. So let's say the mom says no. So if the mom has said yes, you type in the description of the location. How will you describe the client's mental state? So say anxious. So you're looking at the mental state of the caregiver more than that of the child. Does client fear discrimination or violence at home or in the community? She says yes, she's afraid that if she discloses, the child will be rejected in school. Who does the client go to for support at home or in the community? She says nobody, so we'll leave it blank. Does the client come to the clinic on his or her appointment date? So this is the first time, so we do not know. Or this is the second time, so we can't really assess if the client is someone who comes to the clinic always. Has the client been adherent to other medications in the past? So she said that anytime the child has been sick, she has given the medications to completion and has prescribed. Did you plan a drug timetable with the client? So let's say yes. So you would have planned the timetable based on the medications you know that will be prescribed for these clients, or that the clients will have leaving the clinic today. Is the client a member of the care and support group? We'll say no. And if yes, you want to put in the support group. Substance addiction is not applicable. Does the client feel confident about taking or giving children medicines every day for the rest of life? Let's say she says yes. Who else takes care of the child other than the caregiver present? Nobody, so leave it blank. Has the caregiver been trained? This is not applicable. Has the client had any challenges taking other medicine every day at the same time? She said the child has never been so sick since the child was born, and so we can't really assess if they've had challenges taking long-term treatment. Does client know the names of ARVs to be taken and the time? So you would have gone over the names of the medications and the time, and if the caregiver remembers and can repeat after you or demonstrates to you, then yes, if not, no. Does the client know the side effects? So you counsel on side effects management, and when the client understands, yes. Does the client know the consequences of not taking ARVs every day for life? You counsel on it, the client can repeat after you, the client knows it, yes. If not, no. Is the client on other medications other than the ones prescribed by the doctor? We'll say no. So assessment of client readiness to start ART. So let's say the client is ready to start ART. So if there are client's questions and concerns, so you can type in the client's questions about what happens when the treatment is no longer free, would they be able to afford it and all that, and the discussions we have with the clients. If there are other issues and notes, so things like maybe the client will say her job requirement requires she travels 30% of the time, and when she travels, she doesn't know who is going to help the child. The child stays with her dad when the mom travels, but she has refused to disclose to the child's dad. And so you list all those issues in this box here and leave that note. And if you have nothing to type in, you click on save. Once you are done with that session, let us assume that she was not ready and you want to get her ready. You are going to schedule adherence strategy work plan appointment. And you're going to click on adherence strategy work plan. Once you've done this, you'll come back to start counseling encounter, enter the unique ID, and it gives you a form now that is totally different. So this is the third type of form the system generates based on the type of counseling encounter that you selected. So this just asks questions about if you want, if the clients, you're going to refer the clients for a seminar, if you normally have HIV seminars or adherence seminars. And then, so the first question is recommend attendance at a HIV basic seminar. So let's say we have none in the country. Recommend attendance at an adherence basic seminar. Let's say we don't have any. Discuss patients' preferred adherence strategy. So you want to discuss with the caregiver now. They want a treatment partner, self-managed adherence, none, or any other type that is not listed. So she said she wants to go with self-managed adherence. You want to conduct a 1 or 2 weeks practice trial to simulate the commitment and attention necessary for the medication. So let's say you want to give the child nutritional supplements, but you want to put the dosing at the same dosing of the ARV and the same timing to see how they will commit to remembering for a practice trial. So we're going to be giving that once daily. Since the medication, the child will be on OB once daily. Is the client ready to start ARV medication? You now say no, reassess on a later date and save. Once you are done and you save, if you want to review what you have filled in, you come to past counseling encounter, you fill 1, 2, 3, 4, last encounter. So you have 3 tabs here that gives you the 3 types of session. So for this client, we've recorded all 3 sessions, but this gives you the most recent recording. So you have the most recent pre-treatment counseling session recorded, the most recent follow-up assessment recorded, and the most recent strategy work plan recorded. And this concludes the functionality of psychosocial and adherence counseling.